Okay, my next video is healthcare professionals' potential exposure to COVID-19. Now that's coming from the CDC site. After I do this video, I will post the CDC guidelines to that, okay? As some of you know, because we've got a little bit of our team in the COVID team, and then we've got the rest of us doing home care, and some of us are out. We have 6 home care staff out for exposure. Okay, so everyone that's been out, we have got it cleared by Dr. Alves, and now Dr. Alves has stressed the guideline changes based on CDC. So let me just tell you what they are. There's high risk, moderate risk, and low risk. In home care, we want to go to low risk, and I'm going to tell you and show you what we have to do to be in low risk. And the guideline is really clear. High exposure to clients, so somebody who's intubating, somebody who's suctioning a patient, those are all hospital patients. They're high risk, okay? Somebody who's going to be with a patient for it didn't say specified time, but in a hospital setting, in a medical unit, or in a regular unit, if they're going to be spending more time with them, then that's called moderate, okay? Up to this point, we were all doing moderate, including the COVID team and including home care. So as a result, we have 2 staff in the South on 14-day quarantine. So let me tell you what moderate was. Moderate was this and gloves, which I don't have my gloves on, okay? So I'm going to get to low risk exposure, and the COVID team is always going to be on a moderate risk exposure, but not the home care team. They're going to be doing the same practice we're doing in home care, but they're going to be at a different level. So this is low risk. You got to wear your goggles all the time. Pretty cool, huh? Then you've got to get a N95 mask and put that on. And you guys know how to do that, right? So I'm not going to show you all how to do it because I'm going to flunk, okay? So you're going to bring it up and bring it over. I always like to do the bottom one first, and then I bring the second one and bring it over, okay? So you have to have your N95 mask, and now I can't speak, so she cannot breathe. Chicken nut bread. Okay, you have to have your N95 mask, goggles, and gloves, and you're low risk. Let me be clear about that. You must have goggles, you must have your N95, and you must have gloves on. You're low risk in home care. So if you're going to do wound care, if you're going to do anything for more than an hour in contact with a patient, then we're going to want you to wear an isolation gown. If you're a nurse's aide or homemaker giving a bath, then we want you to wear your regular apron that you all wear because it's just splashed right here. But remember, you've got to have this on and you've got to have your N95 on. So now there's another thing we're going to talk about with N95. You're going to be issued 2 N95 if you're doing more than 10 patients a week. If you're doing less than 10 patients a week, you're going to get 1. What we want you to do with the N95 is we want you to, when you're done using it, we want you to spray it with Lysol spray if you have it. If you don't, bleach water. That's my new cologne, by the way, is bleach water. Spray it, and let it air dry. And then when it's done, you're going to want to put it in a Ziploc bag. And so you have a nice, clean N95 mask. Okay? So that's what you're going to be using each time. And every week we're going to issue a new mask to you. So it's your responsibility to come to Jen. She has a clipboard, and you're going to sign out for your N95 mask. For those of you who don't have goggles, you need to check out with Jen. But Jen and Lisa are syncing up who's got goggles. These are kind of flimsy, okay, and they can break. I have a pretty small face, so they kind of fit my face, but some of you, you're gonna have to open it up and you're gonna break it. So you're gonna have to be a little bit gentle with these. Goggles are hard to get for some reason, so we're trying to order some more. But I'm just telling you, glasses aren't gonna work. My glasses, Dr. Alves said, won't work. This won't work, so just wanted to let you know that. Okay, so that's how we're gonna stay low risk. Very important. If you're not going to follow this guideline and you come to us and you tell us that you were told that your patient was tested positive for COVID, moving forward, we cannot and will not take the responsibility of protecting you if you're not going to follow our guidelines. Okay, so I'm going to show you on the I don't know how to do this. Okay, let's see, just show it like that.